is an old saying that indicates if you have your health, you have everything that really matters, because without that, life could really be terrible. Which is why it can be so frustrating to suffer from some debilitating problem and going to see doctors who, one after another, are unable to come up with a solution. And that is what makes the story of Dr. Daniel Pompa so amazing. Dr. Pompa is a chiropractor practicing in the Pittsburgh suburb of Wexford, Pennsylvania. He is a chiropractor, but he specializes in treating what are known as neurotoxic illnesses. And he has clients who come to see him from all over the country, because often in a matter of hours or less, he has been able to come up with a solution to the problem that has been plaguing them for years. For many, he has become their medical messiah, and he has actually changed their lives. And it all came about because he suffered from so many seemingly incurable problems himself.
I specialize in structural correction, which is more than just moving one bone at a time. We're looking at the whole segments of the spine and repositioning them, which has an amazing difference in the fact that it affects your autonomic nerve system. So it's not just about pain, because pain only represents 6% of the nerves. 94% of the nerves actually run function. So when you're doing these structural changes, you're really affecting the function of the body. So that's one different aspect. But the other half of my practice, I treat neurotoxic mediated illness, which is neurotoxic disease, is something that people really probably aren't familiar with the name, but they're familiar with the symptoms. Things like fibromyalgia, chronic fatigue, depression, insomnia, anxiety, hormone imbalance. These are neurotoxic conditions, and they're spreading. This is an epidemic that's really changing America and how we look at health.
What happens when someone comes in here for a first appointment? What's the process you go through with them?
Typically, it really depends on what they're, coming to me for. Some people come to me with a neck pain, and then we're taking x-rays and we're doing things to figure out, okay, what's going on, because there probably or maybe a structural problem. But if a neurotoxic patient comes into me with, say, I can't sleep, I have insomnia, or, I'm on, these medications, I'm depressed, it's not working, then we're going to take a deep history. We're going to figure out when they felt good and what happened. What happened at the time when you started feeling sick? And then I start asking questions. It's really, you're trying to find the needle in the haystack. And typically, you find either a physical trauma or an emotional trauma that occurred during that time. That's why it's one of my pieces of my puzzle of really helping people, because they did something that triggered their immune system, that God-given ability to heal itself, to not work anymore, meaning that their body's not finding balance anymore. They've become out of balance, and now a disease process starts.
When I was about 17, I started to get some bizarre symptoms. I started to get sick. I had severe gastrointestinal issues that would actually cause me to miss chunks of time during the day at school and just lay in the nursing's office and be very, very sick. And that was the first of many symptoms, because I'd been very healthy, I was very athletic, and nothing had bothered me yet. And so they diagnosed me with irritable bowel syndrome and tried different medications on me, and also thought that maybe it was something psychological as well. And so they tried to put me on Zoloft. And in the meantime, I started to gain weight unexplainably. I'd basically gained 40 pounds in 2 years. So I was just depressed because I was in this body. I was on 6 medications, and I was basically feeling like I was getting sicker and sicker on these medications. And I was so young, and I felt like these are the years where I need to be young and healthy. And so a friend of mine recommended Dr. Pompa to me because she knew of all my health issues. I was very skeptical. I didn't want to tell another doctor my story. I didn't want to be put on any more medication. I didn't think anyone would understand. But she got me to come here anyway, listen to one of his talks on toxicity, and he described every symptom I had and packaged it into this toxicity label. And I said, I don't know what toxins are. It kind of sounds scary to me, but I definitely have toxicity. So I was able to lose weight for the first time in years. I was able to lose 18 pounds. I feel free. I don't suffer from depression or mood anymore. I'm high energy. I used to suffer from fatigue. I'd be tired all the time. I'm a different person, and I don't get any cravings for food. I'm all I can say is I'm completely different than I was a year ago, and I thank God that I found Dr. Pompa.
My background's in environmental consulting, so when I graduated I worked out west cleaning up hazardous waste from various industries and abandoned mine cleanup, a lot of toxic heavy metals and environmental toxins. Even though I tried to protect myself in those cleanups, my body was unable to adapt to the toxic load that was being put on my body, and I just started to develop major symptoms such as chronic anxiety, chronic fatigue, upper back pain, fibromyalgia, laying up at night, sweating and not being able to sleep, and the left side of my body was numb and just crying out to God for answers. And through my cousin, I was told about Dr. Pompa. I came in and started just discussing my symptoms with him, and he knew what these symptoms were, and he backed it up with the literature. And so he looked me in the eye and he said, "Warren, do what I tell you to do, eat what I tell you to eat, and you're going to get your life back." And those debilitating symptoms are now gone. My life has turned around, and I just can't thank Dr. Pompa enough for giving me my life back.
Marilee, what was it like for you when your husband got so sick?
It was unbelievable, actually. It was really hard for me to accept that he was sick or that he was getting sick. At the time, I didn't realize that he wasn't as sick as he was actually going to get. He had fatigue, he had debilitating headaches, he wasn't sleeping at night, he couldn't tolerate just normal noises of life and of family. And it was so sad because he was always so healthy. He was never sick. We were known for the way we lived our lives and what we did to be healthy. We did things that nobody else would even consider doing, and we just did it naturally because we were changed by the knowledge that we had.
What happened?
Well, first of all, I wasn't willing to accept that he couldn't figure it out. My husband is brilliant, and I've always known that, and I've just always recognized his gifts. And then whenever all this began unfolding, I realized that this was the vehicle that God was going to use to give him the knowledge, the understanding, the compassion, and everything else that he needed to add to him to make him as effective as he could be. And so I just hung on to that, and I kept reminding him, of course, that you are going to be okay. God has his hand in our life. He has not called you to the profession that he has called you to after you were out doing your thing if it wasn't for the fact that he has an incredible purpose and a plan for our life. Because at the other side, we were going to be very effective, not just in our life and our testimony, but in the opportunity that he was going to have to impact so many people.
To understand the puzzle, you have to really understand, again, my story and what I went through, because I was one of these patients that I now treat. And really through the evolution and, of myself getting well is how that puzzle came together. And it's really looking at somebody as a whole and saying, okay, there's really four main pieces of these really sick individual puzzles. The diet is one of those pieces. We understand that if there's something that we have to remove to get these patients well, these neurotoxins, whether it's a biotoxin, again, a biotoxin is simply a toxin that attacks your nervous system that comes from a living thing. So under that category, you see mold and Lyme. And then in heavy metals, you have things like mercury, lead, arsenic, but all of those things are neurotoxins. It seems in these unexplainable illnesses that it's these neurotoxins that attack your brain and basically every nerve in your body. This is what really makes people very sick. And right now, we have an epidemic of neurotoxic illness in this country. And then the physical nerve stress, or the nerve stress, is a piece of the puzzle, because a lot of these people, and there was a study done in 2005 that showed that when people get in an auto accident or a trauma, it can kick in fibromyalgia. And again, fibromyalgia is just a name for a classic set of symptoms with fatigue and just unanswerable symptoms that nobody can explain. So we know that nerve stress all of a sudden allow these toxins to become a problem. So you could have had, Doug, the toxins in you for many times and your body was dealing with it. Your immune system's dealing with it and clearing it. And all of a sudden you have a trauma, and now all of a sudden these toxins, your body's not dealing with it. So now you're not finding balance, and now you get sick. So that's really the puzzle, and I think that's what we're doing that is so unique, is we really have put these together. Many doctors are treating heavy metals. but they're ignoring the fact of nerve stress that needs to be dealt with. And that's where a lot of my structural correction work comes in. A lot of doctors are dealing with biotoxins, but they're not addressing the heavy metals. So they're not going to get people well to the next degree. A lot of doctors are dealing just in the diet and not realizing there's a major neurotoxin that needs removed. So really that's the idea of the puzzle, is we're putting it all together. And when you treat someone with those 4 pieces of the puzzle, this is how we're getting people well.
Prior to seeing Dr. Pompa, for 5 years, I had suffered with leg pain, and I would get trembling in my legs, twitching. At one point, I couldn't walk. So after 5 years of dealing with this on my own, I found Dr. Pompa and his staff, and at that time, sat down with Dr. Pompa and had a consult, and he told me about his story, and it's very similar to what I had gone through, the pain, the depression. He understood, and for the first time, someone wasn't looking at me like I was crazy. And from that moment on, 1.5 years ago, him and I have had a great relationship, and my life has just been so much better from everything that Dr. Pompa has taught me, from what we've done here in his office. It's pretty amazing, and we did a testimony like this recently, and I had said to my family members, I said, wow, talking about this and telling someone where I was and how far I've come was just amazing. And both my husband and my mother said, we would love to do that. We would love to tell everyone how far you've come, because you're a completely different person. It is amazing, and I think everybody that knows me would attest to that.
I started coming here about 1 year ago, and when I came in, I guess I could start at the head and work down to my toes. I had dizziness, spinning, vertigo, chronic ear infections, asthma. I was sick all of the time. I had tingling and weakness in my arms, the muscles in my arms and legs. I was having some chest pain, digestion problems, and so a good friend of mine actually referred me here, and she said, I think it's time for Dr. Pompa. Now that we've ruled out everything medical, there's no answers. She sent me here, and I went on his healing diet, changed my diet, started getting regular adjustments, and within a week I was off of all medicine, and all of my symptoms had gone away. I know it's hard to believe, but it's real. It happened. And because of it, I can't tell enough people how wonderful it is to come here and experience the healing that I've experienced.
I have 2 diets, because the one thing I always like to say up front is I don't think there's ever one diet for everybody, meaning that we're all genetically different on the inside as we are on the outside. But my basic diet, there's really 3 basic changes that I say everybody needs to make. That I think when, the years of dealing with sick people, I think these are the major changes, and they apply to everybody. However, I have 5 factors to determine who needs my advanced diet, which I call the healing diet.
So then how does the healing diet work, and why?
Well, I think my advanced diet, my healing diet, where, we have these very sick people, we talked about the fact that toxicity is a major cause of these people getting sick. It's a cause for them not being able to lose weight. We get these symptoms like morning stiffness, insomnia, the aches and the pains, headaches that are, just unanswerable things. A lot of that has to do with the hormones and the hormone cascade that goes wrong, basically. So when we're able to get rid of the toxins and then allow this process to heal again and the hormones to fix, the diet really is responsible for this process. The diet is what regulates the hormones again. If we get rid of everything that turns to sugar, then the hormone receptors are allowed to heal again.
Explain something to me. How does someone know if they have toxic agents in their body? How do I know if I don't have them?
There's a simple test that any doctor can do, and it's actually called a visual contrast test. See, when you're toxic, your body you lose oxygen to the optic nerve, as well as other nerves. And it's one of the reasons why people have certain symptoms. But we're able to measure it with just a 5-minute test. And the accuracy, it's 98% accurate. So if you're neurotoxic, this is the first test we're going to do. And I always say when I do my seminars, I can divide the room in half. People who cannot lose weight and people who have tried everything, they're going to fail this test. So people who pass the VCS, they're going to lose weight probably just on my basic diet. People who fail this test, they're not going to lose weight. Matter of fact, they're going to lose 5 or 10 pounds and stop and not lose another pound, and the cravings aren't going to go away. Now, from this then, we would do some follow-up, some blood work, maybe urine tests for heavy metals. But again, this is the first test we do. So between the history, this, and blood work, we're able to make a pretty good diagnosis if someone's neurotoxic. The key to 21st century medicine is understanding hormones and toxicity's effect on hormones and how it causes inflammation. Because a lot of the diseases that we treat, heart disease, cancer, all these bizarre illnesses, rheumatoid arthritis, they're inflammatory conditions that are also being stimulated by the toxins. So not only does it lead to weight problems and the inability to lose weight, but it's leading to degenerative conditions which are just exploding in this country. So if we're going to change the way we think and we're going to get people well, we got to understand toxicity and we got to understand inflammation. And if we do that, then we're going to get people well again.
I was wrestling with some real health problems. I was pre-diabetic. I was very much overweight. I was nearly 30% body fat. I'd come home at night, I was fatigued, I would crash on the couch, and I didn't understand why I was falling asleep and why I had such low energy. One afternoon I come home, I pull out of my mailbox a flyer from Dr. Pompa announcing his seminar. I told my wife I'm going to go to this seminar. And when I came back from that seminar that evening, I knew that I was going to change my life. And I said to my wife, we need to do this. Dr. Pompa has taken everything we know about diets and exercise and weight loss and makes it understandable. So let's clean out the pantry and let's start fresh with his diet. And so that's what we did. And during this time of 1.5 years that I've been with him, I've gone from nearly 300 pounds. I was actually started off at 296 pounds. I've dropped to 210. I've gone from nearly 30% body fat down to 13% body fat. I even got preferred premium on my life insurance because I'm so just healthy now. They can't believe that my blood pressure and my triglycerides and my cholesterol and all those ratings are just completely off the charts to the good. I'm 42 years old, but a lot of people think I'm in my early 30s. In fact, I look better today than I did when I was married at 31.
I love sitting down from somebody, and I love getting the, supposedly uncurable well, and that drives me. And I want to bring this answer to the world. That's my goal. I want people to understand, really, the true cause of the problems that so many people are suffering with. I want to try to change the paradigm. I want a paradigm shift in the way we're thinking about healthcare. I want to try to get people to understand, that if we're going to solve the healthcare crisis, we have to think differently.
The intriguing story of Dr. Daniel Pompa, the chiropractor who does much more and in the process changes people's lives. I'm Doug Llewellyn reporting from Wexford, Pennsylvania.
Well, that does it for this edition of Close Up on America's Business. I'm Janice Marie. Thanks for joining us. We'll see you next time.